I'm Dr. Moosa from Excel Laser Vision Institute, and today I want to take the opportunity to display to you a little bit of the way the eyeball functions and what some of the general conditions are of the eye that we need to treat with laser eye surgery. When you look at the eyeball, this is obviously a great example of how vision enters the eye. Light rays basically go through the cornea, which is the front portion of the eye, through the pupil and behind the lens, and gets focused on the retinal portion of the eye, the neural tissue that then processes the information that's taken to the brain and basically interpreted as what the image is. One of the frequent issues that people come and see us for is astigmatism. And what astigmatism is basically this orthogonal shape that you see. It's on the surface of the cornea, and it's essentially an irregular shape of the cornea. So this area right there is steeper and the other area is flatter. So it creates a distortion of vision or distortion of light that goes through the eyeball and gets distorted when the neural tissue receives the information, and thereby the brain interprets a distorted picture, an image that's not clear. Glasses and contact lenses can correct it only so much. So frequently with glasses, when you correct astigmatism, if your glasses move or shake, the alignment of where it should be correcting the astigmatism could move out of position. With contact lenses, because of the tear moisture layer, and as the contact lens rotates, it can also move out of position, thereby creating less than optimal vision. The reason laser vision correction surgery is so far superior than the other options to correct your vision is when we treat the eye, we not only focus on capturing the picture of where the astigmatism is, we align that picture with the laser system, which then uses proprietary technology to make sure that even if the eyeball rotates during the procedure, that the laser rotates with the eyeball to correct the astigmatism. Once correcting it, and once the astigmatism is removed, the eye shape is perfectly aligned to give the retina a clear image that is then processed by the brain as a clear, precise image, and therefore creating vision that you've otherwise never been able to see with your glasses or contact lenses. I hope this little quick instruction on the way the eye functions has provided some information to you. And ultimately, if it's something you are interested in further, please look us up for a free consultation for laser eye surgery at exceleye.com, where we'll be happy to address any concerns or questions that you have and be able to provide you with more information so you can make an informed decision on what's best for your vision care. Thank you for your time. We're excited to see you come visit us at our office at Excel Laser Vision Institute. We have locations in Los Angeles and Orange County. One of the great experiences you can have is our free comprehensive eye exam that's of no cost to you, but a consultation for LASIK that will establish your candidacy. We look forward to seeing you in the near future.